Good morning, all. Today, going to discuss the ischemic heart diseases. Okay, what is ischemic heart disease? What is ischemic heart disease? Look at this picture. All of you look at this picture. It has shown how it is the ischemic heart disease. There it is specifically indicated the blocked arteries, and there it is differentiated damaged heart muscle. When we see the muscles is different from the others, is normal, you could feel the different. Okay, then ischemic heart diseases is also known as the coronary heart disease. Is conditions where narrowed heart arteries are reduced to blood flow. Narrow means is reduced, there it is a space, is followed to the heart muscle causing chest pain. Chest pain and other name is the medical term, there it is angina or a heart attack. The coronary artery disease is a condition where narrowing heart arteries are reducing blood flow to the heart muscles. What are the major symptoms present in the what are the major symptoms in the ischemic heart diseases? Chest pain or pressure, especially during exertion, then shortness of breath, pain in the upper body including arm, back, neck and jaw, sweating, nausea, indigestion and dizziness, lightheadedness and fatigue. Okay, these are the symptoms. These are the symptoms in the ischemic heart disease: chest pain and the shortness of breathing, pain in the upper body including arms, back, neck or jaw, sweating, nausea and indigestion, dizziness, lightheadedness and fatigue. What are the risk factors? What are the risk factors to get in a disease? Atherosclerosis, blood clot, vasospasm and risk factors. Other risk factors there. Atherosclerosis means most common cause, which is build up the block, the plaque in the coronary arteries. The fat particle or the blood clot there form a plaque in the coronary artery. Then blood clots can completely block the artery. Then vasospasm, sudden tightening to the artery walls. Then risk factors like age, sex, smoking, high blood pressure, high cholesterol, diabetes and obesity can increase the risk. What are the other risk factors? Age, sex, smoking, high blood pressure, high cholesterol, diabetes and obesity is increasing the risk factors. Okay, could you understand? These are the risk factors to produce the ischemic heart disease, that is atherosclerosis, blood clot, vasospasm. Other risk factor: age, sex, smoking, high blood pressure, high cholesterol, diabetes, and obesity to increase the risk. Okay, pathogenesis, how it will be develop the conditions. First, atherosclerosis, the process being built up the fatty deposit, the cholesterol and other substances is coronary arteries, condition known as atherosclerosis. Is lead to formation of the plugs, plates to gradually narrowing the arteries. Atherosclerosis means the deposition of the fat or the cholesterol in the artery. It's lead to form plaques. It's gradually narrowing the artery. Then plaque rupture and thrombosis. Over time, these plaques can rupture and erode, which triggers the formation of the blood clot at the site. The clot can partially and completely block the artery. Already there it is a blocks. There it's formed the cholesterol fatty deposition or the cholesterol is formation of plaques. It's restrict the artery to gradually narrowing the artery. This plug rupture sometimes. These plaques to rupture which trigger the of the blood clot of the site. The clot can be partially or completely block of the artery. Then ischemia, the reduced blood flow, the heart muscles. The reduced blood flow, the heart muscles result to ischemia. The conditions where the muscle doesn't receive enough oxygen. The heart high energy damage make partially and vulnerably to the oxygen deprivation. So we should not get the proper oxygen supply that muscles. Oxygen in the blood. So the heart muscles does not work properly. So that is ischemia. And then inflammation. Chronic inflammation plays a significant role. Progression to the disease conflict, instability and further damage on overbounds neutrophil instead of inflammation. Then obstruct the microvascularity. The chronic inflammation plays a significant role progressive to the plaque instability and further damage. So this is the factor to develop the conditions. Then vasospasm. In some cases, the coronary artery can spasm, causing narrowing, even temporarily close completely, leading to the ischemia, even without significant build-up. Significant one and more block is built up is completely close the artery. That is vasospasm. Then microvascular dysfunction. The conditions adding to the major coronary artery damage to the smaller vessels can also lead to ischemia, impaired to ability, increase in the blood flow when needed. This is often to patients with no significant blockage in the large arteries. Microvascular dysfunction is additions to the major coronary arteries damage to the similar vessels. The consequences of the ischemia. What is the problem in ischemia? Then angina. Angina means less severe reducing blood flow can cause chest pain, discomfort known as angina. Is that the less severe reducing blood flow can cause then chest pain or discomfort known as angina. Then myocardial infarction. The name is called heart attack. The complete blockage of the coronary artery. Then myocardial infarction or heart attack, where part of the heart muscle dies. In which part of the heart muscles it will be affected. Infarction and the heart attack. Myocardial infarction. Then scarring of the heart failure. If the part of the heart muscles is damaged, it can replace and the non-contractile scar tissues over time that can weaken the heart, can lead to the heart failure. These are the consequences of the ischemic heart diseases. Angina, if there is discomfort known as the pain in the chest, myocardial infarction or heart attack, where the part of the heart muscles die, scarring of the heart muscle, the part of muscle damage is replaced over the heart. Then complications. What are the complications in the myocardial infarction? Heart attack, heart failure, arrhythmias and heart valve damage. Heart attack means when the coronary artery becomes completely blocked, cutting off blood flow or oxygen. The part of the heart muscles causing damage. That is heart attack, heart failure, heart muscles damage and weakened, making it unable to pump the blood effectively throughout the body. Then arrhythmia, electrical system or heart disturbed, leading to irregular abnormal heart rhythm that can be life-threatening. Then heart valve problem, the damage of the heart muscles affecting the function, the heart valve leading to the other complications. Okay, these are the major complications to affect the ischemic heart disease, heart attack, or other name is myocardial infarction, heart failure, arrhythmia, heart valve problems. Then other serious complications, so stroke, the sudden cardiac death, and cardiomyopathy. Stroke, sudden cardiac death, cardiomyopathy. Stroke can occur the blood clot the heart in the heart to travel to the brain. The blood clot from in the heart and travel to the brain, block to blood flow. Sudden cardiac death. This is most severe outcome where the heart abruptly stop beating. Other due to severe arrhythmia. Then cardiomyopathy, the conditions where the heart muscles become enlarged or thickened or rigid, which can lead to heart failure. Okay. What are the complications, major complications? Heart attack, heart failure, arrhythmic and heart valve problem. Other associated complications, stroke and sudden cardiac death and cardiomyopathy. Okay. We will see the conservative management. What are the conservative and surgical management? First, we will see conservative management. Goal to control the symptoms that are progressive and disease throughout the invasive means. Key factors, lifestyle changes. When they use the alcohol and the smoking and the diet, they can use the fried things, junk foods like that. They can change it other time. There is this no exercise, they can do it, lead the life. They want to change the lifestyle to diminish or reduce the complications of the conditions. Heart health diet, they can use related to healthy diet, we can take it. Then regular exercise, they can do it in small exercises to get it the maintain the heart conditions. In smoking seasoning, when they are using the smoking, they can stop it the smoking. Then weight management, we should maintain the management. Then medical therapy, the medications. Then risk factor include drugs to blood pressure, cholesterol, to preventing the blood clot, non-invasive testing, regular monitoring access to the disease progression. Then suitability, often to initial approach stable angina, especially symptoms that can control the medication, maybe perform to approach the patient, the chronic kidney diseases. Okay, these are the conservative management. These factors, they can reduce and it will be helpful does not to enter the problem. First, lifestyle changes, health, heart, diet, regular exercise, smoking seasoning, weight management, optimize medical therapy, especially they're including blood pressure, cholesterol and preventing blood clot. A non-invasive test monitoring the disease progressively, the suitability to symptoms well controlled with the medicines. Okay, these are the conservative management. Then we will move surgical management. What are the surgery is done in the ischemic heart disease? The main goal of surgery to restore the blood flow, the heart muscles opening to block the arteries, opening the blocked arteries. The procedure coronary artery bypass graft. The surgical procedure blood vessels from the another part used to bypass the blocked coronary arteries. These are often more extensive surgery, typically those with multiple blockage. Then percutaneous coronary intervention, the less invasive procedure that uses catheter to open blocked arteries, often involving placing stent. Percutaneous coronary intervention, the invasive procedure that uses of catheter to open the blocked artery, often involving the placing the stent. Okay, these are the surgical management. We can do it in the surgery. Could you understand what are the things we have discussed? The ischemic heart diseases. What is ischemic heart disease? It's a narrowing of heart artery, reducing blood flow to the heart muscle caused by angina and heart attack. What are the symptoms? Chest pain, pressure, especially during exertion, the shortness of breath, pain in the upper body including arm, back and neck or jaw, sweating, nausea, indigestion, dizziness and lightheadedness and fatigue. The cause and risk factor. What are the causes to produce the condition? Atherosclerosis is a plague, built up plague and the coronary arteries plague. Then blood clot completely block the arteries. Then vasospasm, a sudden tightening of the artery walls. Risk factor: age, sex, smoking, high blood pressure, and high cholesterol and diabetes and obesity to increase the risk. Then pathogenesis, how it will be develop the conditions: atherosclerosis, the plaque rupture and thrombosis, ischemia, inflammation and vasospasm and microvascular dysfunction. Then what are the consequences of the ischemia? Angina means there it is pain, discomfort to known as angina, myocardial infarction, scarring of the heart. Then complication, major complication: heart attack, heart failure, arrhythmia, heart valve problems. Then other complications: stroke, sudden cardiac death, cardiomyopathy. Stroke means occur if the blood clot from in the heart and travel to the brain is blocked blood flow in the brain. Sudden cardiac death, so heart is stop beating to severe arrhythmia, cardiomyopathy, the muscle become enlarged and thickened and rigid, which can be lead to the heart failure. Then conservative management factors the lifestyle changes, heart health, diet, regular exercises, smoking seasoning, weight management, optimized medical therapy, and non-invasive testing regularly monitored to assess the disease progression and suitability. Surgical procedure and management. Surgical procedure and management. Into surgery, they can done coronary artery bypass grafting. How it will be done? Blocked coronary artery, often the more excessive, extensive surgery typical those two multiple blockage. The blood vessels from the another part of the body used to bypass. Then percutaneous coronary intervention, the less invasive procedure that uses catheter to open blocked artery, often involving the placing stent. Okay, in this procedure we can rectify the ischemic heart diseases. Okay, when you enter the after that college, when you enter the home or the hostel, you can discuss these things. Let us see the conditions in the book. You can do it elaborate and present in the examination. So you take the notes. If you are feel difficulty, you take the notes from the clinical cardio book and make it easy and do it to the examinations. Thank you all.